So rounding out the evening, we're going to have Aaron Sklar from HealthAgen dive deep on design in health and wellness.
I'll just start off with a story. So I'm from HealthAgen. HealthAgen's a portfolio of health tech startups, all focused on population health. My role is I lead design across the portfolio. And today's presentation sort of starts on my first day of work there. So 2 years ago, I show up for work. I'm super excited, really excited about my new role, bringing design to this very clunky world of healthcare. And I go out to lunch with a couple of my new colleagues, and one of them asks me, well, how do you fit into the HealthAgen organization? It's a bunch of different parts, and I start to explain, well, I'm leading design, I'm focused on user experience, and I can tell from the confused looks on their faces that they're not, the conversation is not landing. What is it that design is doing? What is the role? And one of the more senior members of the luncheon sort of charges into my rescue and says, he's in IT. And everyone else was like, okay, nodding heads, he's in IT. And for me, as a designer, I have to admit, my heart sank. I'm like, oh, I am so not in IT. I am a designer and here to make this a usable, useful, engaging experience. And I spent a lot of soul searching, like what the heck am I doing in IT? And this presentation is sort of showing my realization why it makes so much sense, now that I'm 2 years into it, rationalizing, why it makes so much sense for a designer to be part of IT in healthcare. So, I mean, we've all seen, as in other industries, technology's made major advances all around healthcare. Daniel's just showed us about 80,000 of them. But just like in other industries, we are hitting a snag. When you look at this image, you see a doctor, a patient, but what are they focusing on? They're focusing on the technology. And what I'm realizing more and more is that we've been treating technology as the front man. And throughout healthcare, there's this philosophy of if we build it, they will come. And a couple of the speakers have brought up the same message of like, start with what people need. If you just bring in healthcare, we've been starting with technology and just now demanding that doctors come and use it, patients come and use it, and it doesn't always fit. So there's a lot of changes happening in healthcare. And I'll just highlight a couple that we haven't mentioned yet, sort of in the top middle there. Patients are becoming consumers. This is a much more a selective group of patients, choosy and having higher expectations of their providers, of their tools. Obviously, we've all talked about in the bottom there the huge costs and trillions of healthcare in this country. So, as an IT guy, I might get fired for saying this, but it's time for technology to fade into the background of healthcare. And I don't mean fade away. I mean in the background. I mean, we're always going to need continual innovation. We're always going to need constant improvement, iteration, steps forward in the types of technology being provided. But I do mean in the background. As an industry, we've been spending all of our energy designing the technology, and now it's time to start designing for people and for providers. So a quick example, actually, Daniel talked about this a little bit as well. An example of technology being too much in the foreground. I'll just use this stock photography to talk about when Google Maps came out. I was blown away. I just thought that Google Maps was the most amazing technology. I still use it pretty much every day. I use it today to come here. But you can imagine when you put technology into a place where it's not necessarily meant to be, there's a lot of unintended consequences. And this is a great example of technology getting in the way of the end goal. So the whole premise of this presentation is technology is the enabler in healthcare. And what I'm putting forward is design is the engager. And did he just say the E word? The engagement in healthcare is a very hot topic. Lots of baggage, lots of political drama around engagement. But actually, I'm talking about engagement with a twist. When we talk about engagement in healthcare, we're mostly talking about how do we get people to use our software? How do we get people to come and engage with this tool that I provided? And really the conversation needs to be about how do we engage people in their health? How do we get them to engage in their health outcomes? So it's a lot harder to focus on outcomes. It's harder to impact, it's harder to measure, it takes longer. But don't freak out. We've done this before. Other industries have gone through this exact same path, and I'm going to share with you sort of the way that design can be used to make this a smooth transition, using design to fade technology in the background. So, again, the premise of this presentation is using design as a competitive advantage. For simplicity's sake, I divided up the world of design into these 3 steps. And I'll give you a case study from HealthAgen of how we go through those steps. So the first is design research. On the top left, you see the hunt. At the bottom left, you see the hunt for the opportunity. Design research is what is the need. There are a lot of sort of, Kate talked about sort of observations in hospitals. There's lots of methods about ethnography, unpacking the workflow, sort of drawing out the journeys, exploring the competitive landscape. The images here are from one of our businesses is focused on families who have a child in the NICU. And these are images from home visits we did, talking with these families about their experience. How did they communicate? How did they learn? What were their questions? How did they get their questions answered? Really spending time with them and understanding the stress of having your child in the NICU is a very intense situation. The output of that design research phase is always a set of opportunity areas. In this case, we identified sort of 2 headlines of what we wanted to focus on. For the NICU families, we identified, I want to feel taken care of, and I don't want to feel alone. From those headlines, we moved into the next phase of design strategy. So making that opportunity tangible. And sort of the icon of design strategy is the Post-it note. You know, our office got filled with, all the walls filled with Post-it notes. We have Windows, I recommend that. Lots of brainstorming, lots of concept generation, and taking the insights from the research and turning that into sketches, concepts. And the output of that design strategy phase is what we call design directions. So a design direction is not the final product, but this is a visualization of here's what this product should be, could be, how does it work, how does it look. This is a sort of a mock-up of our neonatal app from this stage. The star, I don't know if you can all see the detail, but the star of it is on the left, this image of a nurse, an on-call NICU nurse who's available to that family. So that's the design direction, and from there we moved into the 3rd phase, which is design execution. So crafting the full detailed experience. This is where a lot of us sort of start to think about design, the wireframing, the workflow, building in those signature moments, detailing out all of the details of what is this actually going to look like, and then the output of that phase is the detailed design, the mock-ups, and the instructions for here's how you actually build this out. So that's what we're up to at HealthAgen, is we're using design to fade technology into the background. And I'm really loving the theme of this event and looking forward to continuing the conversation. Feel free to reach out with me, email, here's my Twitter. Thank you.